Hello everyone. I'm Somdatta Karak and I welcome you to CCMB Conversations. This is our space to discuss with experts and understand how science and technology are shaping in India. Today we have Mr. Manoj Kumar with us. Manoj has been a leading name in the Indian startup sector. He is the founder and CEO of Social Alpha. At Social Alpha, they scout for interesting technologies, ideas, and support them to become usable and useful for society. With Manoj, we will try to understand Social Alpha's work and objectives better. And in doing so, we will try to place the role of scientists in entrepreneurship. Thank you, Manoj, for joining us in the CCMB conversations today. Welcome.
Thank you for inviting me.
So, Manoj, I'll start with very basic questions. Can you tell us about what Social Alpha is trying to do?
Yeah. Let me try to make it simpler and more intuitive for your community, which is mostly scientists and researchers. See, a lot of problems that we have in society, whether they are environmental issues related to food, water, soil, healthcare, climate change. To solve these problems, we need breakthrough innovations. And those breakthrough innovations cannot come without a very strong foundation in science. If you look at our own life as consumer, like we today use smartphone, we use internet, we use medicine and vaccines, all or even electricity. Everything that we use at some point of time has originated in the world of science, right, and translated into technology and then a solution that we in our lives use. This works fine. Since industrial revolution, we have seen a lot of technologies coming to business, coming to individuals, coming to communities. But there are many areas where gap between science and society is very visible. Let me give you a few examples. If you look at a last mile healthcare provider like an ASHA worker or primary healthcare center, what science and technology innovation they have access to so that they can provide good quality care or screening or diagnosis to people closer to them. Or if you look at a smallholder farmer, are we creating solutions for them that they can use in improving the quality of their soil, improving productivity, reducing risk, even reducing drudgery? Do we have good quality farm mechanization equipment? Or the world is going through climate crisis. Are we using science to reduce emission, avoid emission? Are we using science to make planet safer? So there are a lot of problems that exist which are not getting addressed, right? I call it market failure. A COVID vaccine we got within a year, I think,
Correct.
if not 1.5. But a TB vaccine we haven't seen yet.
Correct.
Because nobody's priority, right? So what is happening that certain areas, especially those related to poverty, primary care and sustainability, are not getting prioritized. So we built Social Alpha as a not-for-profit platform and operating philanthropy to bridge this gap. That if the scientists in CCMB or any other scientific institute are working on translational research, how can Social Alpha help them as an operating partner to de-risk that solution? De-risk from a technology point of view, de-risk from a business model point of view, make it deployment ready through pilots and iterations, and then deploy, implement at a scale.
Excellent.
Right. So it's really important that innovations go from lab to market to end user, and when that is not happening, social alpha wants to play a role. So that's the whole objective of setting up social alpha.
Can you give an example of how you have been able to work with scientists and what kind of support social alpha has needed to offer them?
It depends on the complexity of the problem. We are not scientists, right? But we can help with certain problems which scientists may ignore. Are you really building a solution that is required? Is there an end user? Is someone we can assign as a customer or end user for your solution? So are you building the right solution? Do you understand where the market is, right? So we bring in that value. And then capital. You may need grant, you may need equity, you may need a distribution system, you may need partners who are bringing different elements. So one, it depends upon how complex is the problem you are solving. It also depends upon what stage you are in. So a scientist who is experimenting at the lab stage probably does not need our help in science, but at that stage she needs our help in identifying market, early discovery. Little later, once you have a proof of concept or a working prototype, we are ready for pilot, you probably need our help in establishing a product market fit or identifying what is the minimum viable product. Little later, you may need our help in fundraising, customer discovery, actual implementation on the ground, right? So if you take a life cycle approach from lab to market to deployment to scale, at each stage you will see what social alpha brings changes. So it's very stage appropriate customer, and what works for one scientific innovation may not work for the other. So our work is very customized, operationally hands-on, and not cohort driven, that we get 10 people in a room and give them a lecture. We don't do that.
Is it very one-to-one?
Very one-to-one, very engaged. Every company that we have in our portfolio has a social alpha portfolio manager assigned to them, and it's like a very strong partnership.
So I'm trying to also place social alpha in the scheme of research institutes, startup incubators, and then the big industry. I mean, where is social alpha really in this?
Let me visualize it, right?
Yeah.
We are tuned to think vertical. This is research institute, then this is incubator, this is industry, this is accelerator, right? Even government schemes are very verticalized, right? You write grant for product development, right? Grant for something else. And we realize that it's not one gap that we have to fill, more like a jigsaw puzzle. Missing pieces are everywhere. So instead of looking vertically, R&D, incubation, go to market or deployment, we look at horizontally. It's a very programmatic approach. What is the problem we are solving, and then work backwards. So it's more integrated, full stack model from lab to market to deployment, rather than a vertical slice that we can insert in the architecture, right? So we remain engaged throughout this life cycle, and that's where the value generation happens.
So in that sense, I mean, are you looking from lab to market or market to lab? Maybe market is not the most correct word here.
I would say customer or end user,
Yeah.
like who experiences the problem you are trying to solve.
Yeah. Yeah.
It's a farmer or an ASHA worker or healthcare provider. The problem flows from there. What science is doing is to appreciate and understand that problem and then do something to solve it.
Got it.
Right? So there is a supply side of innovation, that is maybe in CCMB. There is a demand side of innovation, that may be in a village in Odisha. This orchestration between the supply side and demand side is what we do, and in the process market can get created.
So do you keep collecting innovations from research institutes like CCMB and also keep collecting demands from the
So if you
end
see,
users?
and we believe that the demand and the supply side are the two sides of the same coin. So we, like I have people who are PhDs and can have a conversation with a scientist in your institute, but I also have people who can have the same conversation with a farmer in farmer's language. So what happens if you, and that is what is missing in our startup ecosystem, because our startup ecosystem is schematic, it's verticalized. I am an investor, I only worry about investment. I am an incubator, I only worry about investment. To solve a problem, you cannot think vertically, you have to think horizontally, because different problems may be at different stages of evolution. Some startups start from lab and go up to deployment, but some startups probably have done the pilot and waiting for deployment, right? I give an analogy of school that we are like a K-12 school. Some students start in kindergarten, some in primary school, some in junior school. So we have to make sure that at every stage we identify the need and incrementally fulfill those needs.
Got it. So you are agnostic to the kind of level the scientist's idea is at? Is that
We
correct?
are very agnostic.
Got it.
There are about 20 companies in our portfolio which are still in the lab stage.
And or rather, Social Alpha's work is to still steer that lab level work to something that an end user like an ASHA worker will be able to finally use.
Correct. And sometimes we also find innovators or scientists who have actually built a product, but nobody is buying them.
Correct.
Right? Or nobody is implementing them.
So that's why I was very interested in knowing who is your first stakeholder. Is it the scientist or is it the end user?
End user.
Correct.
For me, innovation is the means to the end.
Yeah.
Right? And some of these complex problems we cannot solve without innovation. But innovation is necessary, not sufficient. You need an entrepreneur also who can carry that. So entrepreneur is real carrier of innovation. Like in biology, you have vector, right? The carrier of infection, right? Innovation requires a carrier. A government office or an NGO cannot carry an innovation, right? You need risk-taking capabilities. So entrepreneurship is the right carrier for innovation if you want to take it from lab to market. Sometimes we see a scientist wants to quit academia and wants to become entrepreneur. We have such cases. Sometimes a scientist wants to be part of the startup, working on science but not necessarily on the operations.
Correct.
Then we would recommend that you find a co-founder who is full-time working on business and operation. Sometimes a scientist says, I have done my research, I have published my paper, I have got patent, I am now looking for someone who can license it and take it forward.
Right.
I'll go for my next investment. That doesn't work in entrepreneurship. That model is not suitable. That model is suitable for industry. So if you see, in every academic institution, there is a conversation about licensing and commercialization that comes from old school, which is still very much prevalent, where you are waiting for an industry who can license your technology and commerce. So commercialization in that case is someone else's responsibility.
Correct.
We are saying that's great. But you know what? No industry is interested in biogas or primary health care or climate change. Then what will you do? So while if you are inventing a new molecule that has treatment for some disease, a pharma company will license, but in their own R&D they would convert it to drug, do the clinical trials, take it to the market. But that's not going to happen in tuberculosis or in farm mechanization. So there are many areas where industry is not interested because of lower cost of lower return on capital or higher risk. We have to then create entrepreneurial activity there.
So are you trying to say that there are questions where big industry is definitely not interested and a scientist is able to work on it scientifically, technologically, and it is also the scientist who is best positioned to take it to the end user?
Most of the path-breaking innovations in the world became commercial success not because they were licensed to a company, because people who did that research actually built company. Look at Google.
Yeah.
Like Larry and Sergey took their research to market, which we use at Google search engine, right? or Edison, who invented electric light bulb, created a company, right? A lot of innovation we have seen where innovators have actually taken to market by becoming entrepreneurs, but it's not necessary. It's also possible that as an innovator, I am interested in continuously improving the quality of the product. I want to keep doing the research in that direction so that I can improve the molecule or do something better. So I find you, who actually is my co-founder and focuses on business, but my skin in the game is there because I am still doing research in the same area. On the other hand, in the licensing model, there is no guarantee that once I have license or transfer technology to you, after that
I completely agree. Yeah.
so that model works,
Yeah.
but that model works in industry mainstream world because industry has its own R&D. They are not dependent upon academia. So once they license, they know what to do with it. That's why they license. And industry will never take the risk of licensing something that they don't know what to do with. Right? On the other hand, a startup has much higher skin in the game because they are actually getting into an unknown territory. Right? So what do you do then, right? And our value is there, right? We cannot, we are not going to be competing with big business. We are trying to help scientists that you have a solution, we can help you take it to market. There are conventional methods of transferring technology to existing players and our unconventional method to take it to market through entrepreneurship.
Got it.
Yeah.
And is there, I mean, how has the community been reacting to it? Do you see more younger people responding to it positively, or this is age agnostic? Also, is there a correct age for entrepreneurship?
No, a lot of myths have been broken. Probably more than half of our entrepreneurs are not coming from elite institutions.
Right.
Right? It's not they are from CSIR, IIT, IISc, that system. They are from places like Jodhpur and Kanpur and Aurangabad, tier 2, tier 3 cities. We are also seeing young people taking risk. We are also seeing a lot of personal pain point people have, like a farmer's son who has seen his father is struggling for irrigation is actually doing some innovation in soil moisture retention, for example.
Yeah.
So we have seen that personal pain point also in time. No fixed, no trend, I would say, but I have a startup where the founder was an associate professor in an IIT, right? Very nice, privileged position, resigned and built the company. Took personal risk for
What
15
enabled them to take this risk? Because I see a lot of people around me being averse to this because they're also very worried that the Indian ecosystem is not entirely ready.
See, entrepreneurship is all about taking risk, and entrepreneurship has no space for entitlement. Ecosystem may not be ready, government schemes may not be really great, but the successful entrepreneurs have shown us in past that you can do it despite that. So entrepreneurship is solving problems despite the constraint of resources. If everything is available, like we have so many government schemes now, all incubators are getting money from government, they are distributing it to the startup. What are those how many unicorns have come from incubation ecosystem, right? So it's not that true entrepreneurship is waiting for ecosystem. Ecosystem helps, policy helps. I'm not saying we should not grow the ecosystem or we should not have startup friendly policies. We should. But I'm saying that it's not a constraint. It's not a constraint. If you look at the history of entrepreneurship in the country, we have seen entrepreneurs, right? In every decade we have seen.
So, I mean, just to summarize our conversation, I mean, what do you think are the biggest opportunities that the Indian ecosystem should be now looking at?
The biggest opportunity India's scientists, I would say, engineers and scientists, they have is that we still have a lot of unsolved, unresolved problems, which means that we have a big unmet market need, and if we solve that, there is a huge potential of creating successful businesses. This is a big opportunity. Number two, that big opportunity is here in India with 1.5 billion people. We have a domestic market for that big opportunity. So if we solve a really big problem at a scale, we can create successful enterprises. And most importantly, if we build something in India and implement in India, it will have global acceptance. So, I can sum up the opportunity in these 3 points.
I want to ask on behalf of the CCMB community, where most people are fundamental biologists, how do you see their role in this entire scheme of things?
I think we have to stop thinking that I am fundamental, you are applied, that person is engineer. The programmatic problem solving approach does not differentiate. If we have to learn from fundamental science, do translation, build product, we have to think seamlessly from lab to market without worrying about the caste system that I will only do fundamental, I am only doing translational. At the end of it, if we want to solve large scale societal problems, we will have to do everything. We will have to do science, we will have to do engineering, we will have to do public policy advocacy, we will have to do financial engineering, we have to do post sales service and everything.
But have you not come across scientists who complain that by doing all of this, their fundamental work gets impacted for worse?
They can, but after Professor C.V. Raman, probably a century back, nobody has been winning Nobel. So, I'm not saying that people are not doing great work, but that fundamental science is also not reflecting in major achievements, right? So, our track record, I think we should not say that science is getting compromised. I think fundamental science is very important. We can continue to do research in increasing the scientific body of knowledge. But then we should also ask question to ourselves that what is the evidence and what is the signal that as fundamental science we are adding value to the global body of science, right?
No, that's a very useful food for thought for the entire community, I think, because there's so much conversation on if we do this, then that gets impacted, and
that's what I'm saying. That in any case is getting impacted, and it's not about either and or. What I'm trying to say, fundamental science is very important. We should definitely do that, but it is not an excuse for not solving some of the problems in climate science, material science, food science that we need desperately, right? We have a nutrition problem, we have a maternal and child health problem, we have an aging population problem knocking at our door, we have a global warming and climate change issue, where we have extreme heat, we have disasters because of climate change. We have thousands of problems. There was one COVID problem that we experienced in our lifetime, but there are many other problems which could be more serious than the COVID problem.
Correct.
Right? And at a time when science is our only hope, at a time when we know that other than science nobody can solve the problems of people and planet, saying that solving problems will be a hindrance to my science and fundamental science research sounds a little elitist to me.
Correct. Yeah. No, I would really like us to spend more time thinking around that as scientists also, on what role we are to be playing in the society today and the coming tomorrow. Thank you so much,
Thank
Manoj.
you.